Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Thank you for viewing today's episode. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on the book and you can connect with me on other social media platforms. Please enjoy this sports medicine video. On today's episode of Dr. Ozello's Sports Medicine Report, I'm going to speak about plantar fasciitis. Some folks call it plantar fasciitis. I call it plantar fasciitis throughout the entire video. I'm going to call it plantar fasciitis. Whatever name that you like to use, it's still the same condition. Plantar fasciitis, it is a stubborn, painful, performance-limiting sports injury. It's an overuse injury. It is one of the most common sources of pain in the heel and in the foot. Plantar fasciitis is a condition that is caused by overuse and faulty biomechanics. Now I'm going to give you a quick anatomy lesson. When we speak about the foot, the plantar aspect is the bottom part of the foot. The dorsum is the top part of the foot. So when we're standing, we are standing on the plantar aspect of our feet. The plantar fascia is a thick band of fibrous tissue located on the plantar aspect of the foot. It connects the forefoot to the heel bone. In medical terminology, the heel bone is called a calcaneus. I'm going to use that term throughout this video, so please remember the calcaneus is the medical term for the heel bone. The plantar fascia connects to the base of the calcaneus in the front part of the bone. So the plantar fascia starts close to the toes on the ball of the foot, goes posterior and connects to the base of the calcaneus in the front part of that bone. The plantar fascia functions like a bowstring to support the foot's medial longitudinal arch. There are several arches in the foot. Medial means that it's closer to the center of the body, and longitudinal means that it runs from front to back. So the plantar fascia functions to support the medial longitudinal arch, which is located on the inside part of the foot. It helps to control motion of the feet. It helps to prevent a motion called hyperpronation. Now, pronation, that is a normal physiological movement. Pronation occurs every time we step down. The inside part of the foot, it drops down and turns inward. That is pronation. Hyperpronation, or sometimes it's called overpronation, is an excessive amount of inward rotation and dropping of the foot. So hyperpronation is too much or excessive amount of pronation. Like I said, pronation is good. It's a normal physiological movement, but hyperpronation is too much, and it is one of the contributing factors for plantar fasciitis. Hyperpronation is a contributing factor for several overuse injuries, including plantar fasciitis. The mechanism of injury of plantar fasciitis is overtraining. Any type of overtraining injuries has three characteristics to it, and I repeat this in almost every one of my Dr. Ozello Sports Medicine reports when I speak about an overtraining injury. These three characteristics involve, these three contributing factors, I should say, are overtraining, which is doing too much training too soon, combined with inadequate rest between training sessions, combined with some type of biomechanical fault. So the first two that I mentioned, the overtraining and the inadequate rest between training sessions, those are what are called extrinsic factors, meaning that they are occurring outside of the body. There's something that we are doing to the body. The intrinsic factor is the last one, is the faulty biomechanics. The intrinsic factor is something that is occurring inside the body. Something is not functioning properly. The intrinsic factors of plantar fasciitis include tightness, or in medical terms what we call hypertonicity of the Achilles tendon and the calf muscles, and weakness in the feet muscles. When we speak about the Achilles tendon is the strongest and thickest tendon in the entire body. It connects to the back part of the calcaneus. Again, the calcaneus is the heel bone. And the plantar fascia connects to the front part of the heel bone down on the bottom. So what happens is when the Achilles tendon and the calf muscles get tight, they start to pull the calcaneus backwards, and this stretches the plantar fascia. It puts the plantar fascia in a stretched position. If you think about this as a tug of war, okay, the calcaneus is the rope, and the Achilles tendon and the calf muscles are one side, and the plantar fascia is the other side. Well, the Achilles tendon and the calf muscles are much stronger, and they are going to win every time. So they are pulling the calcaneus backwards, placing the plantar fascia in a stretched position. Where the symptoms are felt in plantar fasciitis is right where the plantar fascia attaches to the heel bone. The symptoms of plantar fasciitis, I want to say this again, they are located on the base of the heel, in the plantar aspect of the foot, in the direct spot where the plantar fascia connects to the calcaneus. Now these symptoms, I'm going to explain the symptoms to you. They're sharp, stabbing pain right in that spot. You could usually point to that exact area where it's extremely painful. These symptoms are usually worse in the morning or after prolonged sitting or laying down. They may diminish during activity, say if you're out for a jog or if you're doing some type of sport, they may diminish during that activity, but they're going to return with a vengeance when you are done. And again, like I said, they are usually worse in the morning or after prolonged sitting. And I'm going to explain to you why. The plantar fascia connects to the bone. It connects to the covering of the bone. The covering of the bone is called the periosteum. The periosteum starts to get pulled off of the bone. This is what's called periostitis, meaning that the covering of the bone is inflamed and it gets painful because it's being pulled from the actual bone. So that's what's happening, is the plantar fascia is pulling that covering off. If you think of it like Velcro, the cover is being pulled off. So what happens is when we are sitting for a long time or laying down for a long time or we're sleeping for a long time, the muscles are tight in the calf and the Achilles tendon, and they pull the heel backwards. The body is trying to heal itself, so it's trying to attach the periosteum back onto the bone. So when we take those first steps in the morning, that's usually when it is the most painful, because what's happening is the periosteum starts to get torn off the bone right at that spot, that spot where the plantar fascia connects to the calcaneus. That's where the pulling occurs at, and it becomes extremely painful, especially in the morning, or like I said, if you've been sitting for a long time or laying down for a long time. The prevention of plantar fasciitis. I speak about prevention in every one of my videos, and I'm going to say this again. Injury prevention is easier, faster, and less expensive than injury rehabilitation. So do everything you possibly can to prevent the occurrence of an overtraining injury such as plantar fasciitis. You want to have a good training routine. You want to make sure that you do a variety of exercises and target your muscles from numerous angles. Do not do the same exercise over and over again, because you will be repeatedly targeting those muscles and joints and ligaments from the same angle, and it is going to cause a strength imbalance, or it is going to cause those muscles to fatigue too soon. Also, give yourself adequate rest between training sessions. When you have your recovery days, do your stretching, do your foam rolling, get your chiropractic care, get your massage work, your reflexology, make sure you get plenty of sleep, make sure that you eat well. Make sure that you are eating the healthiest choice that you can. All those things are going to help to prevent all sports injuries. Now, specifically, when we speak about plantar fasciitis, of course, you want to do all those things I just mentioned to help prevent any overuse injuries. But when we speak about specifically plantar fasciitis, we want to strengthen the feet and we want to increase the flexibility and decrease the muscle tension in the calf muscles and the Achilles tendon. So we want to stretch the calf muscles and the Achilles tendon. There are numerous exercises that you can do to help to perform that. You can do the very basic ones. You can do advanced ones where you're using a band. Just whatever works best for you. Do a variety of calf and Achilles stretches from a variety of angles. And then strengthen the feet. You can strengthen the feet with several exercises like the short foot exercise, the towel toe grab, toe flexion, toe splaying. I have some videos out on foot strengthening exercises, so go ahead and view those. I'm going to put them on the playlist that I'm going to create after this video, so you can watch that if you do not know how to strengthen the feet. Also, if you don't have any symptoms of plantar fasciitis and you've already strengthened your feet, then you could go to the advanced foot strengthening exercises. Things like running in the pool, running on sand. Those are great exercises. Now, if you have any type of foot or ankle issues, you have to build up to those exercises. Well, first of all, you want to avoid those exercises until you have recovered and can go ahead and attack those exercises once you get up to the advanced level. Also, when we speak about prevention for plantar fasciitis, you can do self-massage on your calf muscles and in your Achilles tendon. Use the foam roller. You can use a tennis ball. You can, if you're hardcore, you can use a lacrosse ball on the calf muscles. You can do self-massage on the Achilles tendon. That is going to help to decrease tension in those areas. Now, if symptoms should occur, take action immediately. This is not a condition that you want to see if it's going to go away. It's like I said, the symptoms may diminish every once in a while, but the source of those symptoms is still going to be there. So get a professional evaluation. I see many people in my office. As a doctor of chiropractic, I treat all types of sports injuries. Plantar fasciitis is a common injury that I see in my office. And I'm going to talk about chiropractic care for it in just a minute. But it's extremely important that you get a professional evaluation to make sure that your diagnosis is plantar fasciitis. You do not want to self-diagnose if you have no medical training. So get a professional evaluation, get professional treatment. That is going to help you into the right path of your rehabilitation. The sooner that you start your treatment, in most cases, the sooner that you are going to be recovering and the sooner you will be back to your activity. The self-treatment for plantar fasciitis, first of all, like I said, you want to start immediately. If those symptoms, usually the symptoms in plantar fasciitis occur in an insidious fashion, meaning that you start to feel it a little bit, and then it goes away, and then it returns, and it gets progressively more constant and more intense. So you want to take action as quickly as you can. You can use ice in the very beginning, put it on the plantar aspect of your foot. You can put an ice pack, or you can use a frozen tennis ball, a frozen water bottle. Always make sure that you have a thin towel or a washcloth or a thick towel between the source of the ice and your foot. You don't want to take a chance on damaging the skin. So always make sure that the ice is not directly contacting your skin by having a towel or a washcloth in between the ice pack and your skin. You can do the ice for about 15 minutes, take it off for about an hour, and then you could do it again. Also, massaging the calf muscles, massaging the Achilles tendon. I already spoke about that, but you can do that with your thumbs, with the palm of your hand. You can use a frozen tennis ball. If you're hardcore, use the lacrosse ball. You can use a foam roller. It is going to help you a great deal. When you use the foam roller, you can do both legs at a time, or you can do one leg at a time. And you can use, when you use the foam roller, you can have the leg straight forward and then turn the leg outwards, so you're getting the outside part of the foot, then turn the leg inwards, so you're getting the inside part of the calf muscles. I'm sorry, I said the foot before. So you're getting the center part of the calf muscles, then the outside part of the calf muscles, then the inside part of the calf muscles. Also, there are several things that you want to do. Ladies, please do not wear high heels if you have plantar fasciitis. If you have symptoms of plantar fasciitis, don't try to walk on the balls of your feet. Some people do that and they say, well, the pain isn't as bad when I do that. Yes, it may not be as bad right at that point, but what that is you are actually in plantar flexion when you're walking on the balls of your feet, and that is the calf muscles contracting and the Achilles tendon is pulling the heel posterior. So that is just making the condition worse in the long run. So try your hardest not to walk on the balls of your feet. There's also a sock that you can wear when you are sleeping. It holds the foot, the ankle in dorsiflexion, so the front part of the foot is moved towards the shin. So it is stretching the calf muscles and the Achilles tendon a little bit and not letting the ankle being pulled into plantar flexion. So you could use that. That is a helpful tool that many of my patients have used. Also, when you're sitting at your desk, when you're working, do not sit for too long. Make sure that you get up and move around, because again, like I spoke about earlier, the calf muscles and the Achilles tendon are going to tighten, and when you get up, it's going to make the symptoms worse. Also, try to have a footrest underneath your desk so that your feet are resting on the footrest. And if you can get one where it rocks back and forth, that's fantastic, because you're doing motion, it's not, no resistance, it's motion in the ankles all day long, and it's going to help to bring some blood flow to the calf muscles into the Achilles tendon. It's going to help to keep them loose and prevent you from being in one static position for a long time. So remember that if you sit at a desk, use a footrest no matter what, but especially if you have plantar fasciitis, it will help you a great deal. Also, when we speak about footwear, I already mentioned the high heels. You want to make sure that you have proper fitting shoes and shoes that support you if you need that extra support. Several things that you can do to help to lessen the source of plantar fasciitis, which obviously is going to help to lessen the symptoms. Before you go to bed at night, you want to stretch your calf muscles and your Achilles tendon. You don't have to do a lot. Just a few minutes of stretching is going to help to decrease the tension in those areas. And then when you get up in the morning, when you wake up in the morning before you get out of bed, do some massage on those calf muscles and on the Achilles tendon. That will help to break up some of the muscle tension in those areas, and it will help when you get up. There may not be as much pull on the calcaneus and as much pain, because you're helping to lessen the source. One more thing is, I love to ride my bike, and I know a lot of you folks love to ride your bike. When you are on the bike, make sure that when you are contacting the pedals, that it is the back part of your foot, say the mid part or the hind foot, that is contacting the pedals. Do not put the balls of your feet on the pedals like we all used to do when we were kids. The reason for that is when you have the balls of your feet contacting the pedal, we go into plantar flexion because we use our calf muscles to help us to pedal. And that puts a great deal of stress on the calf muscles and on the Achilles tendon. They start to get tired, they're contracting, they start to pull the calcaneus backwards, and that places in a great deal of demand and stretch on the plantar fascia. So when you're on your bike, do not contact the pedals with the balls of your foot. Contact the pedals with the middle part or the back part of your foot is the best way to do it. As you know, I am a doctor of chiropractic. I treat sports injuries. I have a family practice, but I treat a lot of sports injuries. Many people have come to me with plantar fasciitis, or they come to me with another condition. They tell me that they have plantar fasciitis. So that is something I recommend to you, is get to a doctor of chiropractic so that you can get the spine adjusted, get the proper nerve flow going down to the lower extremities, get the pelvis adjusted, the hips adjusted, get the fibula bone adjusted, the ankles and the feet, to restore the proper joint motion. That is going to help you to function better. That will help you to, it's going to help to optimize the nerve flow basically, so that your body is functioning better. It will help you with plantar fasciitis. When I have someone who has plantar fasciitis, I look at the entire kinetic chain, or I'm looking at the lower thoracic spine, the lumbar spine, the pelvis, the hips, the knees, the ankles, and the feet. Everything that needs to be adjusted in those areas, I will adjust them to restore that proper skeletal motion and to optimize the nerve flow, especially the calcaneus bone, and then I do some muscle work and some stretching on the calf muscles. In conclusion, plantar fasciitis is a persistent overuse injury. It's a common injury that happens in sports all the time. Like I said, it's an overuse injury. So you want to make sure that you have formulated a good training plan that targets your muscles and your joints from a variety of angles. And you want to make sure that you have adequate rest between training sessions. Prevent this injury by strengthening your feet and stretching your calf muscles and your Achilles tendon. Do everything you can to prevent this injury. If symptoms occur, work your hardest to combat the sources of this injury. So again, strengthen the feet, stretch the calf muscles, decrease the tension in the calf muscles and the Achilles tendon. Stretch the Achilles tendon. It's going to eliminate the source of this condition. That is the key. Eliminate the sources, the extrinsic sources and the intrinsic sources, and will help you to decrease those symptoms. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report when I covered plantar fasciitis. Please go to my website, championshipchiropractic.com, where you can connect with me on other social media platforms. Please feel free to give me a thumbs up and like this video. Also, if you have questions, feedback, or suggestions, please leave them in the comment section below. Plantar fasciitis is a chapter in my book, Running, Maximize Performance, and Minimize Injuries. It is chapter 20, page 111. This is a condition that is preventable and a condition that is treatable. So educate yourself on this condition and do everything you can in your training to prevent this condition and to rehabilitate from this condition. Thank you so much for viewing today's episode of Dr. Ozello's Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Always remember, train hard, train smart, stay injury-free, and accomplish your goals.